Hi, my name is Dr. Aashish Contractor. I am the head of the Department of Cardiac Health and Rehabilitation at the Asian Heart Institute, and I've been with the Asian Heart Institute since its inception in the year 2002. I am also the medical director of the Standard Chartered Mumbai Marathon, and the Asian Heart Institute has been the medical partner of the marathon since its inception in the year 2004.
Doctor, can you tell us more about the concept of cardiac rehabilitation? Who are the candidates for it, and how is it done, and why is it important?
Cardiac rehabilitation, the goal of cardiac rehabilitation really is twofold. The first is to get a person who has recently suffered a heart attack, a bypass surgery, an angioplasty, get them back to normal, into the normal routine as quickly and as safely as possible. That's the first goal. The second goal is to work with the person and his or her risk profile to make sure that we reduce their future long-term risk for heart disease. The way we do it is through assessing the individual, taking a very detailed history, especially of their risk factors, by evaluating them, and then they come into the program regularly. Normally it means 3 times a week. When they come in, we put electrodes on their chest and wirelessly their ECG is monitored. We call that telemetry monitoring. Then we start them on a mild exercise program, a few minutes at a time. We keep building it up. However, exercise, while it's an important component, is not the sole focus of the program. The focus really is on risk factor reduction. So every time the person comes in, we would, for example, measure their blood pressure. If they have diabetes, we'll measure sugar regularly. We'll certainly alter their diet. We'll work on stress reduction. So during cardiac rehabilitation, we work on each and every aspect of heart disease and try and bring risk down to a minimum. To be honest, anybody who has had heart disease or is at high risk for heart disease would be a candidate for cardiac rehabilitation. Therefore, somebody who's had a heart attack, who's had a bypass surgery, who has had an angioplasty, who has had an angiography showing blockages, even some other forms of heart disease like valvular heart disease. Somebody's got a heart valve replaced, that person would be a candidate. Somebody with heart failure, which means a low pumping capacity of the heart, a low ejection fraction, such a person also would be eligible, as well as the high risk people who haven't yet suffered. Let's say a typical office executive, 45 years of age, smokes occasionally, has high blood pressure, borderline sugar levels, little bit overweight. Such a person typically is at risk for heart disease in the future, and we would be working with them.
For more on your health, log on to health.india.com.